Welcome to this presentation regarding eHealth exchange in rural Native American veteran populations. My name is Hannah Basiata, and I hope to capture your attention for a few minutes to talk about this important topic in modern healthcare. Today, we will be discussing the effects of eHealth exchange on the healthcare delivery system to Native American veterans living in rural areas of the United States. Significant behavioral and mental health disorders such as PTSD and depression are well documented within this population, according to Bassett et al. 2014. However, with few community-based resources, these veterans often turn to substance abuse to cope with their ailing mental health. While already at high risk for suicide, untreated or minimally treated mental health disorders can quickly descend into a mental health crisis like threatened or attempted suicide, according to Bassett et al. In 2014. While resources are limited in these rural communities, telehealth and the eHealth exchange provide an opportunity to bridge gaps which currently exist between the Indian Health Services, or IHS, and the VA, or Veterans Administration, according to Goss et al. 2017. As we will see, the adoption and implementation of an eHealth exchange would synthesize efforts from both of these institutions and create a more cohesive and comprehensive healthcare experience for the veteran. Unfortunately, there are many barriers which influence a veteran's ability to receive care within both the IHS and VA systems. Long travel distances for veterans living in rural communities is the factor most commonly cited as a barrier to appropriate healthcare services, according to Sarasano 2017, Goss et al. 2017, and Kramer et al. 2017. According to Sarasano, decrepit rural facilities and understaffed hospitals and clinics also pose a distinct threat to high-quality healthcare for Native American veterans. Few healthcare providers are willing to transplant their families in rural communities, and those incentivized to do so usually stay no longer than their term of service requires, according to Sarasano 2017. All of these obstacles pave the way for telemedicine and an e-health exchange to radically transform access to specialists and mental health professionals who might otherwise be unobtainable for rural Native American veterans. Kramer and her colleagues in 2017 determined that while attempting to provide home care services to Native American veterans on reservations, staff members of the VA had difficulty establishing clients as the staff was initially disregarded and distrusted by the veterans. As the VA staff worked with the already known IHS staff, veterans started to enroll in the VA system. However, several discrepancies were noted which impacted the care received by the veterans. First, while both agencies provided home health services, Native American veterans received free care from IHS, but had to pay out-of-pocket costs like copays when dealing with the VA system. Eligibility criteria for the two agencies also differed. Further frustration came from the incompatibilities of the medical record infrastructure between the two systems. An e-health exchange could have been used in this situation to minimize the disjointed and sometimes redundant care received by veterans who were enrolled in both programs. Secondly, Goss and her colleagues in 2017 discussed the potential opportunities for an e-health exchange, which would connect primary care providers in rural Native American communities to mental health professionals. This interoperability ensured a seamless transition from primary care to mental health and back again for the veterans. In summary, we learned how e-health exchanges can vastly improve the quality and expediency of patient care among Native American veterans living in rural communities. Additionally, we saw how seamless connections between healthcare providers ensured access to vital mental health resources for these patients. General lessons provided by Goss et al. 2017 and Kramer et al. 2017 indicated the need for continuous devotion by healthcare providers to build genuine relationships within the community, as Native Americans are distrustful of outsiders, especially those who are linked to a government entity. Lastly, we highlighted the need for culturally sensitive and competent care, which recognizes and affirms the diverse needs of Native American veterans in rural populations. Implications for future legislation include the need for a broader application of eHealth exchanges to ensure the optimal provision of healthcare to individuals living in rural and remote areas. Interoperable medical record systems would allow greater access to specialized services such as mental health practitioners. This integrated eHealth network would immeasurably improve coordination of patient care among healthcare professionals, as well as support accessibility and transparency of healthcare for patients, resulting in better informed healthcare consumers. Please review these references for this presentation. I deeply appreciate your time and attention. Have a great day.